This is our 3MT presentation on increasing COMBO-10 immunization rates. So some background information on benefits of vaccinating children and following the COMBO-10 schedule. Vaccinating children prevents over 4 million deaths worldwide annually. Low immunization rates also carry an enormous financial threat. The CDC's COMBO-10 vaccine guidelines are evidence-based. The schedule provides vaccinations at the ideal time for a child's immune system to respond appropriately and provides the optimal protection against disease. This project aims to implement targeted strategies to increase COMBO-10 completion rates at a clinic in northern Minnesota. Only 10% of patients at the clinic are completing the combination 10 vaccine series by the recommended age of 24 months, while the national percentage for children born in 2019 was 70%. See Figure 1 for a visual of this data.
The literature review provides insight into the benefit of implementing multiple interventions rather than just one single intervention depicted in Figure 3. Working within the constraints of the available staff and technology of the clinic, the clinical question was developed, which can be reviewed on the poster under the heading Clinical Question. The methods for the project implementation were developed using Cotter's 8-step change process as a framework. Implementation began on June 4th, 2024, following IRB approval with a pre-education survey of the 5 medical assistants of the clinic, followed by individual in-person education sessions provided by the project leaders that consisted of the following: sharing quality improvement goals and the importance of the COMBO-10 series, a flow sheet outlining decision-making and pre-scheduling, a script reviewing how to use presumptive language, and a COMBO-10 series schedule for reference. The post-education survey was distributed on June 11th, 2024. Data collection occurred between June 4th and July 11th, 2024 via the ambulatory quality partner and relayed to the project leaders through email. Figure 2 depicts the timeline and steps of the project implementation.
COMBO-10 compliance increased by 5.7% from 2023 to 2024. This data is reflected in Figure 4. The pre-education survey showed that amongst the 4 completed surveys, staff either agreed or strongly agreed with 11 of 16 statements. The post-education surveys yielded identical results. This data is reflected in Figure 5. The goal of 80% of medical assistants attending an education session was attained. Project leads were interested in also tracking the number of COMBO-10 vaccines given within this time frame compared to the same time last year. However, this data is not routinely tracked by the ambulatory quality partner and was therefore not available.
The differences between the planned and actual implementation of the project influence the results in a number of ways. Firstly, the need to combine the pre-education survey with the individual education sessions restricted the project leaders and their ability to tailor the education provided to the needs and knowledge gaps of the clinic. This was impacted in part by the distance between the project leaders and the clinic, as the clinic was 4 hours away from the project leaders. Secondly, the limited time frame allotted for data collection shortened the amount of time available to evaluate the effects of the project interventions. Recommendations from future researchers are to utilize IT to develop standing orders as part of the intervention in conjunction with current interventions, studying results for a longer period of time, and study with a bigger sample size. Although the desired outcomes were achieved, it is difficult to determine whether or not the interventions were effective due to the influence of the factors above. And then our last slide is just our QR code for references. Thank you.